责。各位媒体朋友，大家下午好，欢迎参加国务院联防联控机制举办的新闻发布会。昨日，国家卫生健康委发布公告，经国务院批准，自2023年1月8日起，解除对新型冠状病毒感染采取中华人民共和国传染病防治法规定的甲类传染病预防控制措施。不再纳入中华人民共和国国境卫生检疫法规定的检疫传染病管理。当前，我国疫情防控进入新阶段，面临新新形势，新任务，工作重点从防感染转向保健康、防重症。
protecting health and preventing serious illnesses, categorizing COVID and managing COVID-19 as type 2 infectious disease has been an adjustment made based on the comprehensive assessment of the virus mutation, pandemic situation, and our control achievements. It is an initiative that we take to keep up pace with the time and to assess the realities on the ground, so in a bid to improve the scientificness, precision, and effectiveness of our control efforts, categorizing and managing COVID-19 as type 2 infectious disease, scrapping quarantine for the infected, scrapping the assessment of close contacts, dropping the zoning of high and risk regions, and scrapping the quarantine measures for inbound travelers and inbound goods. We have categorized treatment for the infected and make adjustment to the health insurance policies. The testing strategy has been adjusted to those who want to be tested will be tested. And we will also adjust the frequency and content of information release. Categorizing and managing COVID-19 as type 2 infectious disease is not to let it rip. Our focus is to robustly prepare health resources with a focus on meeting the medicine needs of the general public, striving out to protect the key groups, including the elderly and children. In particular, we will step up the vaccination of the elder citizens, and we will earnestly enhance the pandemic response in rural areas. Categorizing and managing COVID-19 as type 2 infectious disease will still need the strong support from the general public. The general public is advised to keep good health habits and healthy lifestyle and have good personal protection. Today, we will focus on the measures adopted for categorizing and managing COVID-19 as type 2 infectious disease. We have with us Vice Minister of National Health Commission, Mr. Li Bin. Deputy Director General of the National Administration of Disease Control, Mr. Chang Jile. Director General of Hospital Administration Department of National Health Commission, Madam Zhou Yahui. And Head of the COVID-19 Advisory Group from National Health Commission, Mr. Liang Wannian. Director of the Infectious Disease Prevention Department of CDC, Mr. Ying Wenwu, to take your questions. Now the floor is open for questions. Please identify yourself before you ask your questions. The first question goes to the journalist on the third row from the right side. Thank you. With the Phoenix TV. In 2020, we were hit by COVID-19 and we decided to categorize COVID-19 as type B and manage it under type A. Now we are making the adjustment of the downgrading. What are the conditions that have enabled this round of adjustment? I'd like to invite Mr. Li Bin to take the question. Thank you for your question. The features of any infectious disease is health impact, pandemic situation, and prevention control needs are the basis of our adjustment of downgrading COVID-19 from type A to type B. It is based on the prerequisites. This is also the clear and explicit requirement of the PRC, Prevention Control Law on Infectious Disease. In early 2020, we were hit by one of the major public health emergency with the most rapid transmission and the widest scope of infection and the greatest difficulty in response. Under the leadership of the Party Central Committee with Comrade Xi Jinping at its core, we made decisive decisions to categorize COVID-19 as Type B, but we managed it according to Type A infectious disease. In the past 3 years, with rigorous management, we have withstood 5 shock waves from the global pandemic. We've successfully avoided the prevalence of the strongest transmissible original variant and the Delta variant. We substantially reduced serious illnesses and deaths. We've also won precious time for preparing the health resources, including vaccines and medicines. We've robustly protected the life and health of the general public and made well-coordinated efforts in balancing pandemic response and economic social development. With the virus mutation, pandemic situation changes, the vaccination, and the accumulation of experiences, our response has entered into a new stage. Our response efforts is faced with new situation and new tasks. We've been following closely the features of the virus, making assessment on the evolution of the pandemic, accelerated the vaccination and the medicine supply, and we've been improving health resources and prevention control system to improve the capacity in emergency response. And all these have laid a solid foundation for our proactive adjustment. Therefore, we are well prepared to downgrade COVID-19 into Category B. It is not to let it rip. In the context of pandemic situational changes and virus mutation, Omicron has become the most dominant variant in the world, with a majority number of infection. There is a low incidence of serious illnesses and deaths. International and domestic monitoring data has shown, compared with the original variant and other VOCs, there has been an attenuated pathogenicity, and most of the symptoms are in the upper respiratory tract or fever. We have almost populated the vaccination. We have inoculated 3.4 billion dosages of our population. 92% of the entire population have been jabbed, and 90% and above population have received the full course vaccination. The health literacy of the general public has seen major improvement, and personal protection capacity has been improving. In terms of the prevention control efforts, we've improved the categorized diagnosis and treatment system and improved the capacity building of grassroots level health institutions, increased the number of fever clinics, the ICU beds and wards in designated hospitals with sound stockpile of supplies. We've made well-coordinated efforts in the treatment of COVID-19 patients and the daily medical needs of the general public. Domestic and international antiviral drugs research and development have made major progress. We have 3 formulations and 3 decoctions in our TCM. Health professionals have accumulated rich experiences in responding to the pandemic. Our current focus is ensuring the health, preventing serious illnesses. We've downgraded COVID-19 management to Type B in accordance with the law. It is a major adjustment of our response strategy. It is based on assessment of realities on the ground, and we've been keeping up pace with the time. Such adjustment will better adapt to the virus mutation and the pandemic situational changes. It will be effective in diverting the valuable resources to protecting elderly with underlying diseases, pregnant women and children, and other key groups. And such adjustment will be conducive in ensuring the normal life and work and medical needs. This will also minimize the impact of the pandemic on socio-economic development. Of course, we should be keenly aware that the global pandemic is far from the end. There are still uncertainties with the pandemic. Most countries and regions are still keeping high alert on the prevention and control of COVID-19. Adjusting COVID-19 to the type B infectious disease doesn't mean let it rip. It doesn't mean that the exit of all control measures. Rather, it means we will have refined the services and enhanced the guarantees. Going ahead, we will continue to refine our approaches in accordance with the law. We will categorize it as the type B infectious disease, have a sound preparation of health treatment resources with a focus on meeting the medicine needs of the general public, with a focus on the protection and treatment of the elderly and children.
And also we will pay more attention to the efforts in the rural areas so as to ensure people's healthiness and well-being. Thank you. Now the next question. On the left side, the journalist, the third one. Yeah. Thank you. I'm from the People's Daily. According to the current law, how many types are there in the law for communicable diseases, and what is the standard for classification? After the change, and what will be the changes in the practices? I will give the floor to Chang Jile. Thank you. Thank you for your question. According to China's law on communicable diseases, according to the transmission, virulence, and outbreaks of the communicable diseases, the notifiable diseases in China have three types: type A, B, and type C. And currently, there are 40 diseases that are notifiable. 2 are type A, 27 type B, and 11 type C. And for the type B diseases, there are 2, and including the communicable atypical pneumonia and the anthrax-caused pneumonia. And they are type B, but they are subject to type A management. So that is so-called type B, but type A management. Then in January 2020, after the outbreak of the COVID pandemic, according to our understanding of the pathogens, of the epidemiology and the clinical features of COVID, and also after approval from the State Council, China has decided to include COVID into type B, and yet it will be subject to the type A management. Now, according to the variances of the disease and the changes of the pandemic situation, we have decided to have a transition from type B classification and type A management to type B classification and type B management. After the adjustment, there will be 4 changes in terms of prevention and control efforts. First, in terms of discovering the sources of transmission. Now, in the future, we will, in the past, where it was subject to type A management, we will have the testings of all those working in the risky industries and in the risky areas. But after the disease is subject to type B management, mainly we will look at the data related to people's visits to hospitals, the self-monitoring results, and the testing results of the key population groups in order to identify the patients. And also the communities should still maintain a sufficient number of the PCR testing clones. And we will also make sure that the pharmacy retailers and the online stores will have a sufficient pathogen testing agents to satisfy people's demands. And the second, after COVID is subject to type B management, there will also be changes related to the management of the patients. In the past, the patients and also the suspected cases will be subject to quarantine treatment, and the close contacts also will be subject to epidemiological surveys and observation. But after COVID is subject to type B management to the asymptom patients and the mild cases, they could choose to stay at home for their health management. And also the third change is about the society-wide prevention and control. That's to say, in the future, more of our prevention and control measures and resources will be focused upon the key places, the key institutes, and the key population groups, so as to reduce or even cancel restrictions upon the other institutes and the population groups, so as to minimize interventions of people's normal life and work. And some places are still special. For example, the senior citizens care institutes and orphanages, etc. But for the other places, visitors do not need to have the PCR testing results, and we will also have no more PCR testings for those traveling from the high-risk regions, and also we will no longer classify high-risk areas vis-à-vis low-risk areas. For those in the high-risk areas, in the past, people could not leave their homes, and they will wait for the door-to-door services. In the future, we will no longer do so. And for the cross-border hygiene and quarantine, the travelers to China will no longer be subject to the closed loop and the collective quarantine and isolation. Travelers to China, they only need to fill in the health declaration forms at the customs, and if the situation is normal and if their routine inspection results are normal, they could have freedom in activities. We will no longer have the preventive also sanitation of the imported goods. We will no longer have sample testings of the imported cold chain foods. Thank you. The next question. Thank you. I'm from the CGTN. Now, the pandemic is serious, and there are sudden big increases of the cases, and some have told us that maybe some people could not have access to hospital services. So I would like to know the situation about our supplies of medical and healthcare resources. Are they sufficient for treating the patients? Madam Jia Yahui will answer the question. Yes, we always have attached very importance to the question you have mentioned. In different parts of China and different parts of the country, at different stages of the transmission and the pandemic. Some regions have huge increases of the cases, and therefore there might be shortages of medical and healthcare supplies. And also in some regions, the ICUs are under relatively huge stress, and we have taken multiple measures. We have given guidance to those regions so that they could expand the supplies of medical and healthcare resources so as to treat people. And we have taken the following measures. First, we have expanded the number of the fever departments. We require that for the tertiary, for the secondary level hospitals and above, and for the community hospitals, they should have a fever department. Now, we have more than 16,000 fever departments for the secondary level and the tertiary level hospitals. There are also 41,000 community fever departments. We also have streamlined the process for patients to visit, and we also have increased supplies of medicines in Beijing, Shanghai, Anhui, Jiangsu, and other provinces. They have used the stadiums, the PCR testing centers, and the mobile shelter centers. They have converted these facilities into the temporary fever clinics. And another one is about the tiered diagnosis and treatment. For the different cities, they have their hospital confederations, and in rural areas, the rural community clinics and hospitals also are part of the county hospital-led medical confederations, and they play different roles so as to provide the tiered diagnosis and treatment services.
Third, we've also promoted the online medical services to provide online consultancy and medical prescriptions for the patients. Third-party offline delivery will be provided to meet the medicine needs of the patients. Fourth, we will enhance the medicine supply through various channels. Relevant departments are improving monitoring on the production, delivery, and supply of medicines so as to enable more patients to have access to their medicines through online shops and retail pharmacies. One of our current focus is on the treatment of the patients with severe illnesses. We've been expanding the health resources in different hospitals across the country. Localities have been expanding the treatment capacity in the designated hospitals and quasi-designated hospitals, with a particular focus on the ICU beds numbers, personnel training in the third-level hospitals. We have a daily reshuffling system to deploy schedules in different levels of localities. Another aspect of our intervention is to intervene early. We've been tapping into grassroots health institutions and manage the elderly with underlying diseases. We categorize their health treatment in accordance with the severity of their underlying diseases and severity of the COVID-19. Efforts are well on track. Another focus is that we require health institutions at the tertiary level to play the most important role. Health institutions must expand their ER rooms. The number of ICU beds, the best number in hospitals. We require hospitals to have smooth admission of patients into the ER rooms. And there must be a fast track for the severe patients. For those patients who are staying in the ER rooms within 24 hours, there must be the reshuffling of the resources so that more patients with severe symptoms will be admitted into hospitals for better treatment. By so doing, we will maximize the treatment of the patients with serious illnesses. We require health institutions to implement our existing rich resource experiences, including the treatment of emergent patients and the multidisciplinary consultancy for the patients with serious symptoms. There must be standardized treatment for the COVID-19 patients. Cross-disciplinary services must be provided to the patients. The 120 emergency ambulance services will also be expanded to enhance the capacity in picking up those who call in sick. The ambulance vehicles will also be on duty. Multiple channels will be provided to provide ambulance vehicles to the patients in severe conditions. Besides, we also call on the elder citizens to get vaccinated proactively so as to prevent the onset of serious illnesses or even death. Thank you. Next question goes to the journalist on the fourth row on the right side.
感谢发言人。澎湃新闻记者提问：有网友担心，在当前的疫情形势下，调整为乙类乙管意味着放任不管，必将使疫情更快更大范围传播。也有网友说，调整后可能引发资源挤兑，要评估不足等风险。请问该如何防范调整后可能出现的各种风险？
Some are also worried that this may overwhelm our resources and lead to insufficiency of medicine supply. Will there be such risks? Mr. Liang Wannian is taking the question. Thank you for your question. First, I want to make it clear, categorizing it as type B doesn't mean let it rip. In the initial stage of adjustment, there might be a sudden surge of infections, which may trigger some temporary insufficiency of supply, overwhelmed health resources, or even public panic. Therefore, we have been taking steps to respond to these risks and getting well prepared to ensure a smooth transition. At present, we should pivot our priority from preventing infection to medical treatment. Our goal of efforts is to protect the health of the general public and prevent serious illnesses and ensure the smooth and orderly transition. With a particular focus on the elder citizens, people with underlying diseases, children and maternal women. We should pay attention to their vaccination, their personal protection, their timely treatment after infection. We should maximize the medical needs, guarantee, and minimize the serious illnesses or death to effectively guard off the risks. It is necessary that we take the following measures or enhance the following measures. First, enhance vaccination, in particular the vaccination of the elder citizens and people with chronic diseases. Second, we must improve the medicine supply, including the TCM, Western medicine, and the health or medical equipment. We must make utmost efforts to meet the medicine needs of the general public. Third, it is important that via online health consultancy and science popular knowledge, we should encourage those asymptomatic cases or mild cases, prioritize the choice of a home-based quarantine treatment. For the people at risk, in particular the elder citizens or the seriously sick patients, there should be faster tracks to transfer them to hospitalized treatment and ensure all those should be treated can be treated. Fourth, it is important that we improve categorized diagnosis and treatment mechanism in health institutions, optimize the deployment and allocation of health resources, improve the capacity building of grassroots level health institutions, coordinate the treatment of the infected, and the provision of health services. Fifth, it's important that we have a sound risk communication with the general public. We should provide suggestions on health monitoring, personal protection, home-based medicine use, or even the garbage disposal, so that the general public know clearly how to scientifically use medicines, when should they seek medical advices, when should they seek medical services, and where to go, so that they will have an objective rationale in response to the pandemic. 6. It's important that we give more care and affection to the health professionals and those staff who are maintaining the economic and social life of our society. 7th, we must step up the monitoring of the mutation of the virus, the monitoring over the overstretched health resources to avoid further overwhelming our health resources. Thank you. Next question goes to the journalist on the third row from the left side. Thank you. With the CNS, as the number of infected has been on the surge, it is the focus of our efforts to treat the serious illnesses. How can we channel resources to the most needed? I'd like to invite Mr. Zhao Yahui to take the question. Thank you for your question. I'd like to share some data. First, in terms of the best number of resources, hospitals above second level have a total bed number of 5.61 million, and recent utilization of the beds is around 60%. As of 25th of December, ICU beds numbered 150,000, that is 10.6 beds for 100,000, including 112,000 beds in the health institutions at the third level, and 55 to 60% utilization rate of the ICU beds. We also have 70,000 plus convertible ICU beds. In general, the bed number are sufficient. Of course, there are provinces who are experiencing the peaks of the infections, and they are approaching the critical threshold of the ICU beds numbers. It's important that we expand the numbers or increase the turnover of the ICU beds. As of 25th of December, we have 150,000 dialysis units, 19.7 thousand CRRT, 2,300 plus ECMOs, and 111,000 plus invasive ventilators, 76,000 ventilators, invasive ventilators, 970,000 monitors, and 38,000 plus oxygen inhalers. Our bed numbers and equipment resources are sufficient to meet the needs of the severe cases.
According to the changes of the situation, we will continue to monitor, and also between the different provinces and the regions, there will be the mutual assistance mechanism and the system that for different provinces and the regions, they are at different stages of the pandemic. They have different demands and needs, and we will be in a position to be in therefore direct resources to those very needy places and regions. Thank you. Now the man, on the third line. Thank you. I'm from China Daily, and not long ago, some people have suspicion about the data related to the pandemic, and the Joint Prevention and the Control Mechanism press releases also have made explanations. So after the transition, will you continue to issue the daily data about the pandemic? What will be the changes in terms of the monitoring of the pandemic, data collection, reporting, and releasing? Thank you. 英文 will answer the question. Yes, after the transmission to type B and the type classification, the type B management, we will make the following changes in terms of the monitoring, reporting, and releasing of the data and information. First, about the contents. We will continue to release data about confirmed case numbers, number of severe cases, number of fatalities, but we will no longer release information related to close contacts. We will no longer distinguish between local cases and overseas imported cases. Second, changes of the frequency. And according to the changing situation, in the end, it will be only the release on a monthly basis. And third is about the change of the platform to release the information. The CDC on its websites will on a regular basis release data and information. And fourthly, about change of the monitored content. And it will no longer be the reporting from the communicable disease network direct reporting. It will be about the comprehensive monitoring and the reporting of the number of the cases, the PCR and pathogen testing results, the sentinel hospital monitoring, the key institutes and the key populations groups monitoring, and also monitoring of the variances. Thank you. The next question. I'm from the CGTN, and so COVID now will be subject to Type B classification and Type B management. So 3 years have gone by. So when we look back, and what progress has been made by us as compared to 3 years ago when we were first suffering from the sudden outbreak of the COVID. And for the country's prevention and control strategy, is it the most suitable and appropriate for us at different points of the timing? Yeah, I will give the floor to Mr. Li Bin. Thank you for your question. In the past 3 years, the Communist Party, under the leadership of President Xi Jinping, has always put people and the people's life in the central place. And we have united the Chinese people to fight against the pandemic. It's the people's war, a holistic war. It's a war against a sudden outbreak of diseases. We have ensured the hundreds of millions of people's life and safety, and we have provided conditions for work and life to become normal and for investments to be made. It fully demonstrates the advantages of socialism of China. In the past 3 years, actually, we always have control over the initiative of the fight against the pandemic. In fact, we already have been subject to the implications of the different variances, and we are always in a race against the virus. And in the past, we responded to the emergencies. Later, we had more regular manners of the prevention and control. We now have a more comprehensive prevention and control. We have ensured the success of the battle in Hubei province, in Wuhan, and in Shanghai. We also have effectively dealt with hundreds of outbreaks of the clusters. We also have withstood the challenges of the waves of imported cases from overseas. We have saved the time for the resources to be generated, such as vaccines, the medicines, and the healthcare resources. In the past 3 years, we always have put the people's life and well-being and happiness into the central place. And we have created the mobile shelter hospitals to take care of the mild diseases, and for those above more than 65 years old, for the pregnant women, the kids, and for patients with underlying diseases, we have provided the tiered management and the services. And we have taken a series of the treatment and prevention measures. Actually, the number of the fatalities from the COVID in China is among the lowest in the world. And also, even people's life expectancy has increased from 77.3 years in 2019 to 78.2 years in 2021. In the past 3 years, our prevention and control has always been science-based. There also has been significant breakthroughs in the science and the technology, such as the vaccines, the rapid testing agents, and pharmaceutical R&D. We have the world's biggest scale inoculation program. We also have used big data AI so as to do the epidemiological surveys. We have combined the use of the modern Western medicine and the traditional Chinese medicine, and we have got 3 drugs, 3 Chinese medicine formulas, which have turned out to be very effective by clinical use. And we were the first in the world to discover and isolate the pathogen, to share the genetic sequence, and we also have actively shared our experience, the best practices in prevention and control. We have provided humanitarian aid to many other countries. In the past 3 years, actually, we always have made necessary changes to the way we prevent and control the pandemic. Already the prevention and the control program is in the 9th edition. And also we have issued 20 optimized prevention and control measures, and more measures have been promulgated. We also have improved the measures concerning the diagnosis, the testing, the hospitalization, and quarantine and the separation. We have differentiated prevention and control strategies. We have put more focus upon key areas and the places, key population groups, and the key industries. And we also have promoted inoculation of the vaccines and have enabled more booster shots. And we also have allowed multiple platforms of the vaccines development so as to better protect high-risk population. And in the past 3 years, we also have overall improved our emergency prevention and control measures, and our healthcare system and disease prevention and control system have withstood challenges and the testings. And there have also been significant improvements of the prevention and the control system and efforts. We also have ensured the supplies of the medicines.
In the past 3 years, the whole nation has acted in unison. Localities and departments have been working in close coordination. Industries and sectors have been reaching out to each other, and 1.4 billion Chinese people have tided over difficulties. We have fostered the great ethos of anti-pandemic. We have won the firm confidence against the pandemic. Facts have fully demonstrated that our prevention control strategies and policies are contextualized to our national conditions. They are scientific, effective, they are recognized by the people, and they can withstand the test of history. Next question goes to the journalist on the second row from the left side with the CCTV. After we categorize and manage COVID-19 as type 2 infectious disease, does mean that we will open the door and electrically. What will be the focus of our adjusted measures? Mr. Chang Jile will take the question. Thank you for your question. By understanding it from the wording, in the past we categorized COVID-19 as type A, but manage it as type B. Now we are categorizing and managing COVID-19 as type B. However, we are still managing it. So what we have adjusted and downgraded is only the category. It's not that we are resigning ourselves. Even less, we are letting it rip in full swing. In the past 3 years, we have been prioritizing people's life. We've made steady progress, taking baby steps but non-stopping steps. We've been dynamically adjusting and optimizing our control measures and be constantly more scientific and precise and targeted in our response. This has been an important piece of experiences in China's response. In light of the features of the virus, the vaccination coverage, the preparation in health resources, the accumulation of control and response experiences, the improvement of people's health literacy have been the basis of our comprehensive assessment. And we come to the conclusion that we are well conditioned and eligible to downgrade COVID-19 into Category B and manage it as Type B infectious disease. We are entering into a new stage with new tasks and new situation. An adjustment of our management has been scientific, but also necessary. Categorizing and managing COVID-19 as Type B infectious disease doesn't mean that we are letting down our guard or relenting our efforts. It is not letting it rip. Being it Type A or Type B or even Type C infectious disease, when the infectious disease is spreading, it is necessary for us to adopt control measures. After this round of adjustment, our work target is reprioritized as protecting health and preventing serious illnesses. We are pivoting our focus from preventing infection across the mass to protecting people at risk and reducing the level of serious illnesses or death in a bid to maximize our protection of people's life, safety, and health, and minimizing the pandemic's impact on socio-economic development. After this round of adjustments, the focus of our response measures can be summarized into following aspects. With the three key focuses and one major effort. First, we will improve the protection of key population at risk with a further increased rate of vaccination coverage among the elder citizens. We will carry out a health survey of people older than 65 and have categorized diagnosis and treatment. Second, we will focus on the prevention control in institutions at risk, including the nursing homes, the charity houses, health institutions, schools, and kindergartens. When there are spreading of the pandemic, we will improve the health monitoring of personnel in nursing homes. When needed, these places will also be put on the institutional lockdown to prevent institutional outbreaks. Third, we will focus on the prevention control in key industries. In particular, the public security, transportation, logistics, public utility, including electricity, water, and heating supply. Sectors as such should have a particular focus on personal protection of the staffing, the environmental ventilation, disinfection, and have in place a job rotation system. Fourth, in the large-scale, semi-confined or confined places, we will have the management system in place. We will also have a ready system to manage the large-scale events in places and for events as such. For example, at railway stations, bus stations, wharves, supermarkets, shopping malls, recreational service centers, and on public transportation vehicles. We will adopt necessary measures to minimize the personnel crowding. We may suspend the holding of some large or super spreading events to stagger the coming of any peaks. You may have noticed that these are also explicit requirements in accordance with the PRC's law on infectious disease prevention and control. Besides, we will persistently advocate personal protection. Everyone should assume their own responsibility of protecting their life and their health. So even after we categorize and manage COVID-19 as type 2 infectious disease, we'll continue to advocate the mask mandate, good hand hygiene, and separate dishes. We advise the general public to get full course vaccination. We believe with concerted efforts, we will, towards the end of the day, fight off the pandemic and improve the entire population health. Thank you. Journalist from the fourth row on the left side. With the Southern Metropolitan News. Some publics say that some of the patients have seen white lung in their lung CT. Netizens believe that this might be related to infecting the original variant or lack of vaccination. What is the reason behind the white lung? Will Omicron lead to white lung? Madam Xiao Yahui is taking the question. Thank you for your question. I can make this really clear. The so-called white lung has nothing to do with the Wuhan variant or vaccination. Currently, the dominant variant is Omicron. CDC experts have explained such a situation in previous conferences. Online, we've noticed there are information related to white lung. First, I want to explain what white lung is. In the lung CT, there is this description of white lung. We know that the lung is composed of alveolia, which is filled with air. When it is put on X-ray tracks, the X-rays will show an image of the lung, which should be black. However, if there is an infection and there are inflammatory cells or the exudates, then the lung will be filled with the inflammation and the exudates. The X-ray could not go through it, and then it will show the image of a white lung. So white lung means there are exudates because of inflation. It doesn't mean that the lung has become white. As exudates are absorbed, and the inflation goes away, the white lung image will also go away, and the image of the lung and the X-ray will come back to normal black. It doesn't mean that if there is inflation with the lung, the image will be white. Only when the inflation is serious will the lung become white under an X-ray image. When the inflammation is serious and there are a lot of exudates, and 70 to 8% of the lung will be white under an X-ray image. So inflammation doesn't necessarily mean white lung. Only when the inflammation is serious will there be white lung, and the patient will show hypoxemia. In the current shock wave, the elder citizens with underlying diseases, some of them have shown white lung, but the percentage is still quite low.
Even it's very low now on the internet, the so-called white lung. Some cases of white lung are not the real cases. They don't meet the definition. They are not severe enough to be labeled as white lungs. Then in terms of the treatment for the pathogen, not only COVID could cause the white lungs, the other viruses might also cause pneumonia, such as the RSV influenza virus or for some bacteria. They can also cause pneumonia. And so multiple viruses could cause pneumonia. And so when they are severe enough, the lungs might become white in imaging. But in terms of treatment, there is already expert consensus on the treatment regimen. First, the oxygen supplies, good ventilation, the non-invasive or invasive ventilator, and also ECMO. These all are good instruments, and also there could be the use of the medicines against the pathogens. So after such a treatment, a big percentage of the white lung patients could turn for the better or even recover. Again, I remind you that we need to pay more attention to the healthiness and the well-being of elderly people. If elderly people are infected with COVID, or even they have difficulties in breathing, and the symptoms tend to be severe, they should seek medical help as soon as possible. And also nationwide, for the severe cases of the elderly people, they should directly be sent to tertiary hospitals for help. Thank you. Now the next question. The one on the fourth line.
谢谢发言人。向今日早报记者提问：从传染病防控的历史来看，
if we look at the history of the law on the communicable diseases in the past, we also made changes for the classification or management level of the communicable diseases? What are the criteria for making the changes? Liang Weinian will answer yes. The classified management is always the very important strategy of preventing and controlling communicable diseases, and the dynamic changes to classification are necessary according to scientific principles. Then for communicable diseases, is it notifiable or is it not notifiable? If it is notifiable, what type of a notifiable disease it is? The decision is made on comprehensive consideration of the characteristics of the pathogen, the profiles of the diseases, the transmission speed and the scope, the severity, and the risks to life and social economic impacts. We will also consider other factors such as people's immunological capacity, the prevention and control capacities of the healthcare system, etc. So when these factors change, for example, when we have a better understanding of the pathogen and we have also people are more immunized, then there could be changes to the classification of a particular communicable disease, and after that there will also be optimization and changes to the prevention and control measures and strategies. And so we always have put people's life in the central place. According to the above-mentioned comprehensive factors, according to our forecast and judgments about the pandemic situations at home and abroad, now and in the future, and also according to the needs of balancing socio-economic development and the pandemic prevention and control, we have made the decision of transition. And for communicable diseases, if it can pose a severe threat to people's well-being, life and safety, when it's possible to cause severe economic losses and the social implications, the country could have high-level the intervention measures to citizens and to the society. But if a communicable disease has a reduced threat to people's health, life, and well-being and safety, and when it has reduced implications to the society and to the economy, the government or the country, of course, should dynamically change the severity of our intervention measures. And so when a new communicable disease has just shown up, we don't have a sufficient understanding of its pathogenicity and epidemiological profiles yet, and we are not clear about its transmissibility, the virulence or variances yet. Then in that case, to maximize the protection of our people, we usually will classify the new communicable disease or the emerging communicable disease as a Class B, but it will be subject to Class A management, as we did in 2003, to SARS in 2005, to highly pathogenic avian flu in 2009, the type A H1N1 influenza, etc. But as we have got a better understanding of a particular communicable disease, its pathogen, its epidemiology, as we have got better treatment and diagnosis toolkits, vaccines and medicines, as we have got better best practices of prevention and control measures. Now, for example, for the type 1 H1N1 influenza, it's already classified as the ordinary influenza, and it's subject to Class C monitoring and management. Thank you. So some people say that after the transition, some people on the internet say that we can get relaxed, or even we don't need to wear facial masks if we are in the public places. So do we should still do so in the future? And what are the personal protection measures which are necessary? 英文我 will answer the question. Yes. After the transition to type B classification and yet also type B management, I want to emphasize that the personal protection measures are still very important. First, we should monitor our own healthiness. We should have a regular good lifestyle. We should do exercises. We should have a healthy diet. We should not smoke. We should drink less spirit. We should have a good mood, and we are most responsible for the personal health. And the second, about some specific protection measures, they include washing your hands frequently, and coughing and covering your mouth, and good table manners, and also we should have a ventilation and cleanness indoors. When it's necessary, we should use detergents. When we go to crowded places, we should wear facial masks. The third is about vaccination. If you don't have those counterindications, if you meet the conditions, you should be vaccinated as soon as possible, especially for the elderly people. And it's also necessary to get booster shots. The fourth,
to improve the health monitoring and home-based treatment. If there are symptoms of fever, coughs, the public is advised to have an antigen test. If the result is positive with mild cases, then you can stay on home-based treatment, but during the time of which you should have less contact with other people, have health monitoring of yourself, pay special attention to the development of your symptoms. If the symptoms aggravate, you are advised to have timely hospital visits. Fifth, during the period when the pandemic is still spreading, we still advise fewer social gathering activities. If people have to commute to work, we suggest you just commute between your workplace, your home. And if you test positive, or if you have symptoms of a fever or respiratory tract infection, avoid going outside to minimize the spreading. People with underlying diseases, elder citizens, children, maternal women are suggested to have fewer gathering or going outside. When the pandemic is widespread, We do not suggest their visits to KTVs, theaters, or semi-confined places where board games, role-playing games, or other recreational semi-confined places. Thank you. Next question goes to the journalist on the first row on the right side.
谢谢主持人。中央广播电视总台财经节目中心
With
记
the
者提问：
financial center
马上
of
临近元旦和
CCTV,
春节了，随着人员的
with the
流
New
动，
Year
疫
and
情
Spring
传播的风
Festival
险进一
around
步
the
加大。
corner,
我
there
们都
will
知
be
道，
a
农村
greater
地
people
区的医疗
mobility.
资源
And
相对
will
薄
that
弱一点。那
exacerbate
实
the
行
risk
乙
of
类管之
transmission?
后，
Rural
农村地
areas
区的医
have
疗
a
救治
weaker
以
health
及药品保
resources
障工
after
作
we
将如何开
categorize
展？谢谢。
COVID-19 as type B
好，请
infectious
焦亚辉女士
disease.
来回
How
答这
can
个
the
问题。
rural areas
好，
be
谢谢您的
prepared
提
in the
问。
treatment
那么
capacity
农
and
村的疫
medicine
情防
supply?
控和健
Madam
康服
Jiao
务
Yahui
呢，
is taking the
也是我们
question.
高度关注
The
的。
health services
做
in
好
rural
农村的疫
areas
情防控
has
呢，也是
caught
今届
our
的疫情防
attention.
控的重点。
Have a good
做好农
prevention
村的这个
control
疫情
in
防
the
控呢，
rural
其实最
areas
主要的
is
是
one of
2 点
our
的关键
focus.
措施。
We
一方面
focus
呢，
on
就是
the
药
following
品
two
要能
aspects.
下去，
First,
就是药品要能配
medicines
送
should be
到
able to be
最末端、最
distributed to
终
the
端
last
的。
mile.
除了县和乡以外呢，
Not
那么村
only
卫
the
生室像这些
counties,
地方
but
呢，都
also
能
the
够要配
villages
足
and the
配
village
齐
clinics
需要的
should
药
be
品。
equipped
另外一个重点
sufficiently
呢，就
with
是
the
重
needed
症能
medicines.
够转上来。
Second,
就是在农
it's
村地区
important
发生
that
了这个重症患者以
patients
后，能够
with
及时的把他
serious
转运出来，
illnesses
送到
can
有
be
救治能力
transferred
的医疗机
to
构去
the
就诊。
hospitals capable of
为此呢，我
providing
们也出
treatment.
台了相关的这个措施呢，
To realize
要
these
求加
goals,
强
we've
农村的
adopted
疫情防
measures
控，
to
特别是
improve
在2节
the
期间呢，我们对
preparedness
这
in
些工
rural
作呢也
areas.
做出了部署和安排。
We have
首
made
先呢
work
是
deployment
要求呢，
during
在农
the
村以
Spring
县为
Festival
单
and
位
the
网
New
格
Year
化的布
in
局呢，县域
rural
的一共
areas.
体。那么县
County-based
乡村呢
grid management
都要
system
发
is
挥
in
各自的
place
承
by
担的这个
setting
功
up
能任
the
务。
rural
那
hospital
么
alliances.
把我们这些特别是
Village
老年人有
hospitals
合并症的这些老年人，
must
包
have
括
a clear
儿童呢，这些
understanding
高风
of
险人群
people at
都纳
risk,
入到我们医
including
联
the
体的这个
elder
管理范围
citizens,
当中来。
children, and those
那么
with
第二点
underlying
呢，就是我
diseases.
们要
Second,
充分发
we
挥
must tap
我们国家
into
已经建立起来的城
the
乡对口支
roles
援的这样的
of
一个
the
机制。
urban to
我
rural
们要
paired
求呢，
up
在
system.
省内呢，以充分发挥城
In
市的优质医
any
疗资源的
province,
作
we
用，
must tap
由城
into
市的2
the
级以上
roles
的
of
医院呢，
quality
跟县医
healthcare
院呢建立
in
这种结
cities.
对的关系，
And there
来
must
进
be
行
the
分区
pairing
包
up
片儿。
between
那
provincial
么一
level
旦发生
hospitals
这
and
个
village
需要重
clinics.
症救治的情况呢，也
Once
要
there
建立
are
呢市和
patients
县
with
之间的
serious
2级转诊
illnesses,
的这样的一个
there should
机
be
制。
a smooth
第3个呢，
transfer
就是要充分发挥
between the
基层医
paired
疗
up
卫生机构的作用，
hospitals.
由乡
Third,
镇
it's
卫生院、
important
村卫
that
生室呢，
we make
把
a
这些高
joint
风
use
险人
of
群能够
the
管理好，
roles of
对他们的健康状
grassroots
况
level
进
health
行摸底，
institutions.
根据不同的
There
健
must
康
be a
风险
clear
等
and
级呢，
thorough
来实施
understanding
健
of
康的这
people
个
at risk in
管理。
rural
那么
areas
一
and
旦
have
发生这个
classified
情况变化
management
的
in
时候呢，
accordance with
要
the
及
health
时的
risk.
转诊。那么第4个呢，就是要进
Timely
行分
transfer
级诊
is
疗
also
和分类
emphasized.
的救
Fourth,
治，
we
特
should
别是
have a
对于
clear
这些重
classified
症的患者
diagnosis
呢，
and treatment
要
system.
立
In
即
particular,
转诊到
patients
具备
in
相应
severe
救治能
conditions
力的
must
医疗
be
机构。
immediately
那么如果
transferred
患
to
者
health
不具备
institutions
转诊
capable
条
of
件的时候
treatment.
呢，我们也
When
要
the
求呢，城
conditions
市
are not
支援
ripe,
的医院呢，
we also
要通过
require the
远程
paired
或者
up
是派驻
city
专家指导的
hospitals
方式呢，来
should
指导这个医疗
dispatch
救治。
contingents of
我们也
experts to
要求呢，
provide
各地
on-site
在2
treatment
节
or
期
provide
间，
online
那么
services.
一方面呢是要
During the
支援的
New
医
Year
院
and
要
the
通
Spring
过派
Festival,
驻人员
the
在
assisting
县医院
hospitals
要驻
must
点指导。
dispatch
另外，我们也要
experts
求各地
to
呢，利用
provide
巡回
on-site
医疗
guidance
车
in
或者是
rural
组派巡
areas.
回医疗队，
And the county
在
level
2节期间
hospitals
呢，
can
加
also
大
have
对农村地区
patrolling
的巡诊的
health
力度，及
vehicles
时发现
to
高风险
provide
人群，
mobile
及早参与
services
采
to
取呢
identify
相应
people
的
at
干预的
risk
措
at
施。
an early
谢谢。
time and provide
好，谢谢。
intervention
请
at an
继续提
early
问。
time.
好，先来请右
Thank
侧
you.
区第2
Next
排
question
报告
goes
第
to
1
the
位。
journalist on the second row from the right side.
谢谢主持人。光明日报社记者提问：在近3年的疫情防控中，属地政府部门、单位和个人落实四方责任发挥了重要作用。那么在调整为一类一管以后，四方责任将会有哪些变化？谢谢。
organizations and individuals after we categorize and manage COVID-19 as type 2 infectious disease. Will there be any changes to the four parties' roles? Mr. Chang Jile is taking the question. Thank you for your question. Indeed, as you've mentioned, in the past 3 years of response, when we were categorizing COVID-19 as type 2 while managing it as type A infectious disease, local governments, departments, organizations and individuals have played instrumental role in responding to the pandemic. This has also been a valuable experience we've garnered from the response to the pandemic, worthy to be further drawn on in our future response to any type of infectious disease. After we categorize and manage COVID-19 as type 2 infectious disease, we need to continuously tap into the roles of the four parties so as to consolidate the social fabric of joint response and have a good response to the pandemic. However, admittedly, the content of management of any infectious disease in type A and type 2 differ. Therefore, there will be corresponding adjustment of the four-party responsibility. For example, local government role is changing when COVID-19 is managed as a type A infectious disease. The local government is not only managing but also serving. But most of their efforts are in managing the epidemiological survey into the close contacts, the zoning of the risk regions, the management of people at risk, and the quarantine of people at risk. This is what we are already familiar with. After we categorize and manage COVID-19 as a type 2 infectious disease, the local government will pivot its focus to service, with a particular focus on monitoring, early warning, epidemiological information releasing, and enhancing and improving the treatment services. Meanwhile, the local government is expected to provide health education, guide the general public to have to follow the mask mandate, have a good hand hygiene, good ventilation, keep on with the good health habits. Industry departments, in the period of categorizing and managing COVID-19 as type A infectious disease, were guiding industries and organizations to follow through and operationalize the prevention control measures. For example, the Department of Education has been managing the campuses, and the foreign-related departments have been managing the inbound and outbound travelers. The departments of culture and tourism have put forward administrative measures on managing people at risk and putting them on closed-loop management. As we downgrade and manage COVID-19 as type 2 infectious diseases, the departments should pivot their work focus to advocating the self-protection of the staffing for post-vaccination and home-based self-treatment after infection. Nursing homes, orphanages, kindergartens, schools, and the competent authorities of these institutions should continue to play an important guidance role if the pandemic is still spreading. When it comes to the roles of the organizations, when COVID-19 is managed as type A infectious diseases, the organizations will take the body temperature of their staffing and monitor their symptoms, and urge the people with the anomalous symptom to seek medical services, and will advise those people with infections to be quarantined. Organizations will also carry out the screening, registration, and reporting of people at risk. While we downgrade COVID-19 into Category B, organizations will pivot to providing more services to the staffing, including health monitoring and vaccination. For example, as the cases are spreading, the organizations will continue to provide services like health monitoring and urge the staff to get vaccinated. Schools, nursing homes, and other key institutions should continue to do a good job in the pandemic prevention control. As I've introduced previously, when it is necessary, rigorous prevention control measures should be started to prevent outbreak.
Then for individuals are the first safeguards responsible for our own health. In fact, after the transition, I think even before the transition, individuals were very cooperative with the government, the departments, and the employers. And also, in the past 3 years, the people's health literacy has been significantly improved and upgraded. It's fair to say the people's support and cooperation is a very important reason for China to have a significant achievements in terms of preventing and controlling the pandemic. Mr. Li has talked about it. He has said that a very important recipe is the people's battle. It's the people's war against new communicable disease. But after the transition to the type B classification and the type B management, as Mr. Ying has said, we should not relax in terms of personal protection measures. In important places, we should wear facial masks, we should wash hands frequently, we should have a good ventilation. It's also recommendable to use use each other's own chopsticks. And this, I think, more healthy lifestyle can be called the social vaccination. So, as always, we recommend that please get inoculated and also please adopt the above-mentioned manners of a healthy lifestyle. Thank you. Now, the next question, the lady on the right side. Thank you. I'm from Hong Kong, Zhongqing Shi, and globally, the pandemic is still ongoing. The WHO has not cancelled the label of the pandemic as a public health emergency of international concern. So how about the prevention and control policies in other countries and regions, and how have we balanced the domestic and international prevention and control situations before we make the decision of the transition? Yingwen will answer. Yes, as you have said, the pandemic is still ongoing, and there are still uncertainties of the variation of the virus. Inside China, the pandemic is fast reaching a peak. Then different regions and areas will have different timetables for reaching the peak of the pandemic because of the different levels of prevention and control measures, because of the differences in terms of people's compliance with those measures, and also differences in terms of personal habits, mobility, population density, etc. According to the Oxford Policies Strictness Index and some overseas official website information, you could see the majority of the countries in the world have changed their prevention and control strategies and measures. Many already have cancelled restrictions concerning the schools, workplaces, public events, gatherings, public transport, home-based self-care, domestic and international travel, etc. Some countries now only require facial masks. So for the transition, we have considered comprehensively the changes and profiles of the transmissibility and the virulence of Omicron. We have well considered its likelihood of causing deaths and severe cases. We also have considered the changes of the situations in other countries. We have made the transition in order to better comply with the new situations and with the new features of the COVID variants, and to better balance the pandemic control, socio-economic development, so as also to minimize the impact to socio-economic development. Now we have the last question. The lady on the left-hand side.
谢谢法新社记者
Yes,
提问。我用
from
英文
the
表达我的问题。
Faxische, the French news
My question is
agency.
about the CDC's methodology for tracking the number of infections and deaths. Why is there a difference between the daily number of infections estimated by local officials and the CDC figures? For example, today the CDC announced 26 COVID cases in Zhejiang province, but Zhejiang local officials recently estimated there were over 1 million new COVID infections per day. How do you explain this difference? Thank you.
好，请翻译一下问题。
我用英文来提问，我想问一下 CDC 疾控中心在追踪感染数目方面的方法和当地政府之间是否有不同？比方说，今日呢，根据浙江省政府所公布的是26例感染的数据，但是 CDC 公布的是100万。请问这种在追踪感染数目方面是否有方式上的不同？谢谢。
好，请殷文武先生来。
Mr. Yin Wenwu will take the question.
在这个防控措施调整之后
After the transition,
多种这个措施收集相
we
关的
have taken multiple measures to collect data about the pandemic so as to make a judgment about its severity and its trends.
这个法定传染病这个
For the notifiable diseases, the notifiable disease reporting network also gives us data. But of course, there are not less data because in the past we had massive PCR campaigns, but now no more. We also collect data from hospitals and health care facilities. For example, the number of confirmed cases, the number of severe cases, the number of fatalities. We also make use of big data. For example, the sales of fever drugs at pharmacies and also the hotline request for help. So we make use of multiple sources of data so that it will be complementary. In that way, we will better measure and judge the severity of the pandemic, the peaking and the trends. And also the central government has a close contact with the local governments. The local governments also play a very proactive role. For example, some local governments do surveys of infection at the community level. Some do online questionnaires to collect data. They also are the additional sources of data which can help us better make judgments. So we continue to monitor, pay close attention to, and make judgments about the pandemic. Whenever we have the latest, we will provide to the public. Now we will have the last question. On the left-hand side, the gentleman. I'm from Xinhua News Agency. I think we have the expectation that we can have a normal life as before the pandemic. So after the transition to Type B classification and the Type B management, are we one step closer to returning to normal? Now the last question will be taken up by Liang Wannian. Yeah, thank you for your question. For the transition, it's based upon our understanding of the transmissibility and the virulence of Omicron. It's based upon the data of the severe cases, fatalities. It's based upon changes of the pandemic internationally. So the transition is based upon a comprehensive consideration. And yes, it's fair to say we have made another step forward towards exiting from the pandemic. But don't forget, globally, the pandemic is still ongoing. And there are still a lot of uncertainties concerning the future variances of the virus. Inside China, many regions are fast reaching the peak in terms of the number of infections. Yet the different regions will have different timetables in terms of reaching the peak levels of infections because of the differences in terms of population mobility, population density, and vaccination ratio. So the different regions will, one after another, face pressure in terms of the transmissibility, in terms of the healthcare resource scarcity, and we will not let it be. We will have a more accurate, precision-based, and science-based prevention and control, and we put more focus upon the treatment of severe cases while ensuring people's daily demand for healthcare services. We will do our best to prevent the run of medical and healthcare resources and focus upon rural areas more.
At present, it's important to follow through their new tasks. In terms of the government, departments, organizations, and individuals, government, departments, and health institutions will continue to follow their mandate in accordance with law, continue to do a good job in preventing, controlling the diseases and treating the diseases, make utmost efforts to reduce the number of severe cases, reducing death numbers, and protecting health. On the other hand, it's important that we need the general public to continue to implement relevant control and measures, have good personal protection, seek medical services reasonably, reduce unnecessary gathering, and reduce the impact of the peak on health resources. As long as we firm up our confidence, come together as one, we will achieve the final success against the pandemic. Thank you. Thank you. On today's press conference, our guest speakers have taken questions on categorizing and managing COVID-19 as type 2 infectious disease. I'd like to thank again the guests for taking the question. I believe there will be a lot of questions when we are shifting the focus. We'll continue to hold future conferences to answer your questions. Please stay tuned. Thank you.